Dr. Tiffany Ahlberg with Ahlberg Audiology is back on the show with us this morning, and we are not going to let her forget. The last time she was here, I asked a question and she said, nope, I'm going to answer that for you the next time. So here we are at the next time.
Yay.
Good to see you.
Good to see you too.
So when you were here last, we had this great conversation about the impact behaviorally and emotionally and socially that hearing loss can bring, and there's a difference though in slow onset hearing loss and sudden hearing loss, and that's your focus today.
Yes, sudden hearing loss is way more common than people realize. And I just had a neighbor that recently that called and she said, Tiffany, my hearing, I'm real dizzy. My hearing is down. I just lost all my hearing. I was like, oh my goodness, we got to get you in as soon as possible. And that's the thing that people don't realize. If something like that happens, I know your thing is like, I don't feel good. I just want to wait a little bit. You can't. You have to seek medical help right then. It is so important to address a sudden hearing loss as soon as it happens.
And the reason is because if you address it within that window, you can regain the hearing?
Not always, but there is a much, much higher chance of regaining your hearing if it is addressed and you seek. So the way that a lot of people will have appointments is they'll say, I have a hearing loss, I just lost all my hearing. They'll come in, we can do the hearing test. Of course, I'm not a medical doctor. I can't do anything for that hearing loss, but I can get people in for emergency visits with the ENT as soon as possible. And those emergency visits happen a lot faster when we know diagnostically that that hearing loss did happen.
It's the networking.
Yes, well, and it's just knowing that that is the issue, and then the ENTs are like, yes, we have to get that person in.
So is it obvious? I know that sounds dumb, but is it obvious that you've all of a sudden lost your hearing? Do you hear like an echo? Is it just foggy?
I'll just tell you, I have had this twice in my life, which I know that, like, I feel like everything audiologically, like, God has blessed me with, so I'm able to empathize with people when they have that. But almost every single time that I run into this, with myself included, you wake up with it. So you wake up and you just don't hear. Like, you feel like your ears stopped up, you feel like there's fluid in it, you feel like it's full. Sometimes, like my neighbor recently, she experienced severe dizziness, and that can happen with it as well. But it feels like your ears stopped up and you just need to pop it. And so sometimes it is misdiagnosed as someone having fluid in their ear, which is terrible because, again, they're not getting the right treatment for that if that's the wrong diagnosis.
Does it tend to happen in just one ear or both?
Yes, it almost always happens in one ear.
And what's the cause of it usually?
It is idiopathic sudden sensorineural hearing loss, which means no one really knows exactly why it happens. We do see a higher prevalence of diabetic patients having that issue, but you know, that's it. They're really, sometimes people theorize that it might be a virus that attacks the ear, but in the end, you just don't know. We just don't know. The medical community really doesn't know most of the time.
So
what causes it.
if you should wake up, or even if it's not in the early morning, if you just notice it and you simply cannot hear, don't even wait 5 minutes. Just
call and we do emergency hearing tests. We got to get people in, and then we will refer out. I mean, if you have already a relationship with an ENT, you can call them too, and you know they'll do the same.
If it's not fluid, then what is it that's how do you treat it?
So they will often, again, I'm not the medical doctor here, but most of the time they will do steroid treatment, which can be oral steroids, or they can do an intratympanic steroid shot treatment in the ear.
So it's an infection or inflammation or something that's causing it. Wow. And then if you've experienced that, do you have to be careful of how you're living for a while to make sure it doesn't reoccur?
No, I mean,
it just pops in and pops out.
Yeah, I mean, hopefully it pops out. You know, sometimes it happens and it doesn't get better. So it's a scary thing, and again, it's more common than people realize. So I just want to, more of a public service announcement, if you or anyone you know wakes up with that, you've got to get them treatment as soon as possible.
Can it happen when you're a younger person, like in your 20s or 30s?
I have a patient right now that I'm getting ready to do a cochlear implant on the, he's got great hearing on one side. He's in his late 20s, maybe early 30s. And it happened, I mean, when I had it, I was in my very early 30s. So yeah, it happens with younger people all the time.
Well, you know, if you're like me, my refrigerator should be full of notes about things that I need to make sure I remember, because when a crisis hits, you kind of can panic sometimes.
Yeah.
So put a number on the refrigerator in the event that you ever need it. But you're going to need it anyway, because if you're 50 years old, you should be getting a baseline hearing test. We talked about that last time too. Ahlberg Audiology, 2 locations in Cleveland and in Athens. The phone numbers are there on your screen. And a good public service announcement from her today. Don't wait if you have that sudden hearing loss. Thank you.
Thank you.